Together for a healthier and sustainable future. This was the theme of the RC69. What have we achieved? We had 22 member states coming together to discuss for 4 days what can we do together in this region where we have so many problems, but where we have also a very rich culture, a lot of experience, tradition, resources, commitments, and many of us know and have the capacity to implement, to know what we need to do and to implement it in real terms for the population in this region. So 4 days talking, it was much more than talking. There were first of all many ministers here, so top-level representation. There was full commitment to further to work together in this region on the Sustainable Development Goals, not only on the core health goals, that everybody has access to universal health coverage, that we are fighting the emergencies and the conflicts in our region, that we help the many people who have become refugees, who had to leave their homes, who live under very difficult conditions. On top of that, the problem of COVID during the last 2 years, there was a lot of experience sharing of practically how we can help, what we can do together. It's not only the issue for COVID with the vaccination, it's also to assist and to maintain all the other essential services which are suffering when you live in countries which have conflicts or other emergencies. So there was much agreement what to do to keep up vaccination rates. There was much agreement what to do to strengthen primary healthcare services. There was a lot agreement of what specifically to do to be better prepared if another pandemic is arising, if another outbreak is happening, to prevent and then also to make our systems more resilient so that we can not only respond, but that we can drive better afterwards. So in conclusion, the ministers who have come here together, they are leaving this place with a joint understanding that for the next year and for the next 5 years in our strategic framework to come, we are fully committed to serve the populations in our region. Those countries which have resources, which have capacities, they will help those ones who have more difficulties. So we are sharing experience, and we have agreed that WHO has the leadership in health to work together with other UN agencies to support the ministries of health, not only for the health sector, but for multi-sectoral action. And the last word, health for peace. It has generated, again, in our region as a strong initiative. It has become a global initiative in the World Health Assembly, but it is now back in our region to translate the agenda and initiative into practical steps in the country. And we all agreed, all countries are committed to develop the roadmap and to implement strong initiatives for health and peace in our region.